this system is currently installed in over 250 other health systems across the country, and it is starting to be installed in Europe and in the Middle East. And so when we selected the product, we had a lot of discussions with other academic medical centers who were using the product. And we could see it. We actually traveled to those sites and saw it in use there. So there is, for obvious reasons, because of the rhetoric coming out of Washington about the importance of healthcare IT, there's a lot of interest in community hospitals and group practices of going to an electronic medical record. And we're in fact in discussions with some groups about whether we could actually host the application for those centers. Say Mercy Hospital here in Iowa City. So say they had one computer system and we were running Epic, and you were seen in both. Currently, the vendor-based systems do not have built into them the tools that allow a seamless flow, so your record automatically goes in and can be properly loaded. There are a series of national standards that have just recently, in the past year or two, been defined, and vendors are modifying their systems to meet those standards. And I and a couple of members of my staff are working on a statewide initiative to create a health information exchange here within the state of Iowa that would include standards for sharing that data among disparate centers or disparate computer systems. So it's not common practice, it's not easy today. It is possible within Epic to do that. So, for example, University of California, San Diego is an Epic site. And if you were routinely seen here at Iowa, your medical information was here, and you were vacationing in UC in San Diego, and something came up that required you to go to the emergency room, it is possible that the physician at San Diego could, what we call, break the glass, and their Epic system could communicate to our Epic system and fetch your your electronic information. And there'd be records of it everywhere, so it would be very transparent to all parties that that happened. But then it would automatically load in that location. The response from the pharmacists and the nurses have been, and the ancillary healthcare providers, I think, has been strong. Like any new system, when you first implement it, it changes the way you work. And there are people in the world who embrace change, and there are people in the world who struggle with change. So you have that reaction regardless of whether you're putting in a clinical system or any kind of a system. But by and large, I think those providers have been very strong. For the physicians, what we implemented is a dramatic change for them. Going from a paper-based system to an electronic system, that's an evolutionary change for them. And there are physicians who are very comfortable with a keyboard. They like to work that way. Outside of their clinical practice, that's how they do everything. I think those groups are recognizing the benefits of this kind of system and are adopting it, and in fact are quickly getting ahead of us in that they want to do more things with the system than we're ready for. Likewise, there's the group that is struggling because they're not used to typing into the computer system. Now, we have provisions in this deployment for people to dictate, and they can dictate their progress notes, and they can dictate their clinical summaries, and a clerical staff person transcribes that and enters that into the system. It's not as efficient doing it that way, and that was intentional because we believe the future of medicine is less of that kind of activity and more of the hands-on direct action. But we're still, it's been our experience here and the experience of other sites who have gone through this that a change of this magnitude often takes 90 days or more for people to really get comfortable with the system and adjust their workflow accordingly. And we're right in the middle of that right now. So I would be willing to bet if you stopped and randomly polled 10 physicians, a number of them would be happy, a number of them would be very non-committal about it, and then a couple of them would probably be very unhappy because this was such a dramatic change for them.